morning. We're here today in the Center Business District of Sherburne on a beautiful day. We're going to be talking with Roger Scott inside of Walgreens here about what he does and how he does as pharmacy manager for Walgreens here in Sherburne. So let's go meet Roger now. Good morning. This morning we're inside of Walgreens in the Central Business District of Sherburne. We're here with Roger Scott. Roger is the pharmacy manager at Walgreens. Walgreens is the pharmacy America trusts since 1901. So good morning, Roger. How are you?
Good morning, Jim.
Good to see you.
Good to see you. I'd like to welcome you to our Walgreens. I've been the pharmacy manager here now. I've been a pharmacist who has been a pharmacist for 43 years, and 39 of which have been in serving the local communities of Dover, Sherburne, and Natick, and other surrounding communities. We find that we like to be very helpful to the local community, and we're always there for them. I'd like to introduce to you my staff. Tara McKechnie has been a Walgreens pharmacist for the past 7 years. She's worked for Walgreens for 9 years. She's an exceptional help and a wonderful pharmacist. I'm very pleased to have her on my staff. Megan Haggerty. Megan is a certified tech, and certified techs do all of the grunge work. They always get all the fill-in parts for all the pharmacists to have the smooth and handling of their prescriptions. If there's an issue with insurance, Megan straightens that out. She loads the prescriptions into the computer to be filled, puts all the directions in there, and we keep we check everything that gets done so there are no errors made. So we work as a team, try to have a smooth transition once the prescription comes in to when it goes out of the pharmacy. We also have two other certified techs who are not here today. We have Jacqueline Curtis and we have Bassam Raphael, and both of them have quite long experience as technicians and have done been very helpful to the community. Then we have Judy, who's our front store manager. Judy's responsible for taking care of all the items you see on the front of this store. She orders and she puts away the orders, and she makes sure that we have all the customers taken care of with their needs. If you can't find it in our pharmacy, Judy will be the one to make sure that we can get it for you, either through the warehouse or through our local wholesaler or through another Walgreens pharmacy. We have the ability also for a lot of our items to be ordered through the other Walgreens, such as if there are durable medical equipment such as wheelchairs and walkers and canes and crutches. We don't carry them all at this location because of the size of this location, but we do have the ability to get them through our Wellesley Walgreens in the hills of Wellesley. And if there's some compounding, which we do here, but other compounds that we cannot fill, we send them through our pharmacy in Framingham on Route 9. Let me take you for a walk through the pharmacy. Okay, I'd like to take you for a little trip through the pharmacy. And you can see we have blood pressure monitors and blood glucose monitoring systems and the necessary strips and lancets that go with it. We carry a line of nicotine products to help you stop smoking, which is essential that you stop smoking for your own health. We need to help you with that. We have the product to do so. We have a line of children's products for pain relief and for colds, and we have stockings, support type hose, braces, and we can help you get some of those. If we don't have the right one, we can get it through our Wellesley operation that carries a broader line of product. These are everyday items that you find at most pharmacies. Walgreens, we have, of course, cough and cold, analgesics, and that pretty much is a standard mix of those. I would like to emphasize our line of nutritional products. I think that we can help a lot of people who have problems with their nutrition to get it up to the next level and get themselves in better health through proper nutrition. We have a complete line of incontinence supplies. So we have all sizes, all types, all manufacturers, and if you have an unfortunate situation or you need them, we got it, or we can get it if we don't have the right ones. We do have a supply of hearing aid batteries, various types of hearing aid batteries. We have a full line of vitamins, various manufacturers, and a full aisle of all of the vitamins, as well as everyday aids for antacids and laxatives. We have full line of dental products over here, and a baby section on this side here. As you can see, we have baby food, we have all of the diapers and the washcloths, mixes of cereal, and a few baby items that complement the rest of the section. We recommend, of course, that everyone uses sunscreen so they don't get the skin cancers that one can develop if they're not taking care of their skin. Very important. And of course, we have the standard items, the deodorants, the shave creams, the bath and body, the hair goods, and a nice skincare aisle with anti-aging, acne preparations, and the like. We carry a full line of Hallmark greeting cards.
Roger, thanks for that tour.
Thank
Can
you.
you describe this area of the store that deals with the patient consultation?
Yes, we have a patient consultation area where you get a one-on-one with your pharmacist. You can handle all of your questions in privacy over in this area. We will just come right over as pharmacists and answer your questions. So if you have a medication question, maybe you just started a new medication, and you need to know how to properly take it, or do you take this at dinner time, or what time of the day you're going to take it, and when's the best time to take it, and review the directions the doctor gave you on that prescription and make sure everything that the doctor's office said was, we reinforce that at the pharmacy. We can handle any situations where we've had consultations required by insurance companies where the actual patient comes in, brings all their medication by. We go through every single medication one by one to make sure that the patient understands the medication, what they're taking it for, and that they're taking it properly. If they have any questions, they can ask at the time. We can review their immunization history. We can call their doctors for their lab values on their make sure their labs are okay, and that if they have any issues that they're having, we can notify the physician as to they're having excessive side effects, and we can maybe change the medication to something more suitable that will take care of their health condition that they were treating with fewer side effects, or improve the way that they are taking their daily doses. We have at the pharmacy an adherence card that we can make up for patients who have problems keeping to a schedule, and believe it or not, in this country, 1 out of 3 people only take their medication properly. So that means 2 out of 3 are doing something wrong. In some dramatic cases where we find that the elderly or someone who just can't remember to take their medication, we can make a blister pack. And on this blister pack, we have the day of the week on the side. We have the time of day on the top, and we open the card here that has their medication. It actually is designed specifically for the patient. It identifies the medication they're taking. It tells them the time to take it, and basically they have a description of the pill that's inside. So we have this very helpful thing. We charge $3 for the makeup of the card. We include free delivery so that we have that patient never can take too much medication, but will have exactly what they need for that week. So keep down any potential medication errors from too much. I forgot to take my medication, or did I take my medication? It answers it. All you have to do is punch out the morning slot. You know you had your morning meds and so on and so forth. And it's very easy to keep track of. Other features we can do at the pharmacy. We have for the child who is not too good at taking a medication, we find because of the tastes, we have the ability to put flavorings that are designed for medications into a particular prescription. So if we have a mother come up to the counter and says, "Oh boy, he's taken that medication before and it was horrible trying to get that in and couldn't get the doses to be taken," so we can say, what flavor does the child like? So if the child likes, say, bubble gum, we can see if bubble gum flavoring goes with the medication that the physician ordered. And we can put the appropriate amount of bubble gum flavoring into the product, and then we have a happy mother, father, and child. So that we have to have patient compliance in the youngest of the young. So we can do that here. We have a Prescription Savings Club. Prescription Savings Club is designed for the underinsured or the uninsured. So if you don't have a prescription copay that's, if you didn't have that with your insurance policy and you need to take medication, you can come into the pharmacy. We'll be happy to go through the list of medications that you take. We can give you the pricing that it would cost on this Prescription Savings Club. The fee is it's an annual fee. It's $20 for an individual. It's $35 for a family, and we do include pets. So if you have people on your pets are on medication, we can get great pricing for your pets. The co-pays have gone as low as $10 for a 90-day supply of medication. So for $10, that's a remarkably low amount of money to be paying for a prescription, and there are many drugs that fall into that category. We have a guarantee associated with the club. So if you pay $20 for it, and at the end of a year you haven't got your $20 in value back, we will find out how much the difference is and apply it to for the next year's card. And it's just a no-lose situation if you don't have insurance. Unfortunately, if you're eligible for a government program, then you cannot participate in the club. There's just a restriction put on, so we have to comply with that. So not everybody is eligible, but I do recommend anybody should look at it who takes regular maintenance medications and see the comparison between those prices and what they pay for on their insurance, or if they have high copays, they can even take advantage of the situation that we offer on the pricing.
And Roger, can you talk about the ordering of prescriptions and computer use for prescriptions and how that works for you?
Yes, we have a very unique telephone system, and on the telephone system you can key in the prescription number and the refills that you have on your container at home, and that can be submitted right to our computer. Our computer will address the time that you designate that you'll put into it when you're going to pick it up, and it'll just automatically go into the system. If there is an issue requiring a contact of a physician, say it was the last refill of your prescription, we can handle that through the computer. It'll send automatic emails to the doctor requiring, the next time we need this prescription, we don't have any refills remaining, your patient needs this, and the doctor can just do that through e-scribe, electronic transmission of the prescription, very prompt, usually done the same day, and just allows a smoother filling of your prescriptions.
I have one of these things. Can you tell me how that could help me out?
Yes, Walgreens offers a free app for a cell phone that you can order your prescriptions by just taking a picture with your cell phone of your prescription label. It will send it to the pharmacy and actually order the prescription for you. We have one gentleman in particular who loves this application, and he just takes his pictures and comes in and his prescription's sitting there waiting for him. So we also can transfer prescriptions from other pharmacies. So if you went to another pharmacy, you could just take a picture of their label, and we'll do the work for it. We'll get that show up on our computer. We make the call to whatever pharmacy that may be and get that prescription so it'll be ready for you when you get here.
I have my phone back. Thank you.
Thank you. The other side too is we have prescription management from your home computer. So if you give us your email, we put an email into you. You approve that that is you, so that there is no strange things going on with your computer account. And you can actually manage your prescriptions from your computer at home by filling in auto refills, which you can do at the store as well. You can tell us, I'd like to have my maintenance medications on auto refill. Therefore, you don't even have to make telephone calls to the pharmacy. It'll be done. And you can have your monthly medication or your 3-month medication just filled when it's due. It will pick up on it. The system will pick up on it and order it for you. So it saves you a lot of time in that regard.
Can you talk to me about the interaction of medications and how you can help me make sure that the medications that I'm getting are safe for me and my family?
Well, one thing we have in the computer system is fantastic. I mean, you have multiple patients, so there's a lot of going on when you have a busy day. So we have a fail-safe system. So it has many checks and balances in the system. So when you have an interaction, you can actually code it. I mean, it'll pop up and there's a little reminder to the pharmacist. The pharmacist will take a look at it. If I consider that to be some interaction that should be of concern, then I will call your physician or talk to you about it. If there's a potential for any situation to arise, discuss it with you in the consultation area. So we can teach your safety is first. So we have promptness, we have safety, and we also have the ability to take care of people at home. So we have free delivery for our customers. The delivery is, with the price of gas at $4 a gallon, it's a great value since it's free on our part. We haven't decided to raise any prices on that, and no immediate intent to do so. We can take care of the homebound, and we can take care of the people with their very busy schedules, and we can set that up, and we find it to work smoothly. Everybody likes our delivery driver, Paul, and he knows the area. He's been doing that in this area for at least 9 years. So
what are your store hours?
we are open Monday through Friday, 8 a.m. to 8 p.m. We are open on Saturdays, 8 a.m. to 6 p.m. and every Sunday from 9 to 3. We have deliveries Monday through Friday. We have holiday hours, usually run something like 9 to 5. So another feature this year the state of Massachusetts has allowed, what many other states have in the country, which is an immunization program to be administered by certified pharmacists, which Tara and I are both certified. We can take care of your flu vaccinations, your shingles vaccinations, hepatitis A and B, and pneumonia, and many, many other vaccinations. There's probably about 9 or 10 in all. And all you have to do and pop into the pharmacy. We have the ability to take care of you without a wait. So you need to get the vaccination. It's on your mind today. Let's get it done. You don't have to drive into the physician's office, park in the parking garage, and take care of that. We can handle it locally. And I think that you given the opportunity to allow yourself to take care of your own health. We try to delegate a lot to the patient, so we want the patient to take their medications properly. We want them to be able to have their questions answered here, and We want to make sure they do the best things for themselves. So I think in all, we're what you could call a whole pharmacy, and I'm very pleased to be part of it. And I know my crew works hard for the community, and will continue to do so.
So Roger, thank you very much for the overview.
Jim,
Appreciate
thank
that
you very much.
Thank you very much.
All right.
Yep.